And next, I'm delighted to introduce my colleague and friend, Dr. Joel Breman, who is a senior scientist emeritus at the National Institutes of Health Fogarty International Center. Dr. Breman has a long and distinguished career in public health and has been a world leader in bringing attention to the problem of malaria. Dr. Breman has authored over 125 publications on infectious diseases and research capacity strengthening in low-income countries. Dr. Breman investigated the first Ebola hemorrhagic fever outbreak as a member of an international commission in 1976. And by the way, for those of you here present at UNC in the May Center, Joel will be speaking about that experience at 2 p.m. this afternoon in room 1301. Dr. Breman has been chair of the WHO Technical Advisory Group on Human Monkeypox and vice president of the WHO International Commission certifying the eradication of guinea worm, among many other activities. Dr. Breman holds an MD from the University of Southern California and a diploma in tropical public health from the London School of Hygiene and Tropical Medicine. Welcome, Dr. Breman.
Thank you, Jim. And thank you, Dean Reimer and Dean Lewin, for welcoming us and making the school, both of your schools, hosting this very important event. So let me first talk about what we're talking about. If we see the universe of all medicines, we hope that all medicines are of good quality. As Dean Bluen explained, content, dissolution, stability, purity, those are what we hope. Every drug, every vaccine, every diagnostic, every biological that we face is of good quality. What we're talking about are these three categories presented in a schematic way. Intentionally fraudulent production by criminals of medicines that usually have no active pharmaceutical ingredient. There are a number of terms. They're called fake, spurious, falsely labeled, counterfeit. We're calling them falsified, that's the WHO term, and we should not get confused by so many other terms that have hindered the movement in councils of discussion due to definitions. On the right, we see substandard drugs that are produced by bona fide companies, pharmaceutical companies, and these generally have low drug content, but they could have high to high content, they could have stability problems or other poor qualities as mentioned by Dean Bluen. Then we have a category we'll call degraded that may leave the category in good quality, but due to heat, storage, transport, or preservation with stabilizing factors are degraded in transport, on the shelf, or due to other factors. In fact, just this last weekend, GlaxoSmithKline recalled 2 million doses of influenza vaccine that were degrading too fast. So, is this a pandemic? We're often asked, are you making a big deal out of something? We haven't heard about this before. And if we look in the dictionary of epidemiology, we'll find that an epidemic occurring over a wide area, crossing international boundaries, affecting a very large number of people, fits the bill for what we're talking about. And in the papers that you have access to, you will find confirmation of that. Here is the WHO Rapid Alert Map, a map that has been recently created following a 2-year intensive activity by the Essential Drugs Program at WHO showing that they are doing some training in workshops. And in just 2 years, they found that over 600 products have been reported, most of them as falsified, in 73 countries. And so WHO has put out some alerts warning people. That's been their action. Now, one company that has been very active and cooperating and transparent in what they're doing is Pfizer. And they have found that their products have been falsified in 2008, 75 countries, in another 30 or so countries just last year. And the number of products falsified has more than doubled in this period. Supply chain breaches are those problems where their products have been taken and sold without Pfizer's approval, without the country's knowledge, and this is also increasing. So if you don't think that those provide some evidence that this is increasing, here are just a quick look at the PubMed presentations, the articles, which from 2000 have almost doubled every 5 years. So as mentioned before, this is certainly an underestimate of the problem regarding the pandemic. So we at NIH got interested in this for something that Dr. Meshnik presented, that is the biology and evolution of drug resistance to the artemisinin compounds, which first were noted in the mid-2000s. And the first papers started coming out later during that decade. And we at NIH called a conference, an international conference, on the biology, epidemiology, immunology, molecular genetics of the phenomena, and we brought in a couple of experts to share with us information on the fake drug problem, not knowing at all if this contributed to it, how wide it was, and we were stunned to find out, particularly in Asia, that there was a high incidence of falsified antimalarials. So we put young Gorvika Nair on the case in 2010 to assemble, through gray literature, reports, WHO, those few at that time drug companies who would cooperate with us, and we found that of close to 4,000 samples from Southeast Asia and sub-Saharan Africa, that 35% of 7 classes of antimalarials were falsified. Absolutely no active ingredient. And you saw the statistics from malaria here. Of the artemisinin compounds, which is not here in the abstract, up to 42% of those compounds were fake. So this is just some shots showing a good manufacturing site. And if you look on the right, you will see the conditions under which the criminals create these products we've talked about. They're also very wily in creating holograms. On the upper left, you'll see a bona fide hologram for artemisinin compound, and the other 3 are absolute fakes. On the bottom right, you'll see a compound widely used. On the left is a counterfeit, and on the right, authentic. And every time I show this, half the group votes for the left side and half for the right. You cannot tell the difference. So in closing, let me just comment on our recommendations here. We need a much more activist leadership organization involving inventorying of the technologies, the products, giving this information out to the countries, doing training, setting standards, and doing things like other activist programs are doing in the world. We don't have that yet. Things like our FDA is involved in with experts. The science and technology agenda, about which you're going to hear very soon, is important. Which are the best technologies, both at the main laboratory through the chemists, in the field through the epidemiologists, and the surveillance and epidemiology is key. Protocols, techniques, standardized. As mentioned, we don't know the extent of the problem. And then lastly, we need international and national laws and policies, covenants, treaties that have worked with so many other things. You're going to hear about all these things today. Thank you very much.